Today, what I'd like to do is to go over a condition that we see quite often in the clinic and one that may be affecting you right now. And that condition is a condition that I refer to as sacroiliac joint dysfunction. Now, the sacroiliac joint is a joint that is here in the pelvis. And before we get into that, just a little bit of an anatomy lesson. The spine is composed of 24 moving vertebrae that sit on top of this bone here called the sacrum. And the sacrum is part of the pelvic girdle. Now, the pelvis itself is basically a ring of bone that's composed of 3 bones and 3 joints. The 3 bones would be the 2 pelvic bones here, and then the 3rd bone would be the sacrum here. Okay, so the sacrum here is wedged, you'll be able to see this here, is wedged between the 2 pelvic bones. The 3 joints would be the symphysis pubis on the front side. That's where the 2 pelvic bones come together and form a joint on the front side. And then on the back side, you have the 2 sacroiliac joints themselves. Now, the sacroiliac joints are different than some of the other joints in our bodies where the joint surfaces are smooth and glide over one another. Because of the position of the sacrum being wedged between the 2 pelvic bones and having to bear the incumbent weight of the spine itself along with the upper torso, this joint, or these joints, both sacroiliac joints, have to be very, very stable. So instead of being smooth and being able to glide over one another, this joint mechanism basically locks into place. There's a little bit of movement that occurs, and we'll talk about that here in a minute, but this joint has to be very, very stable because of the weight of the body that's falling right here onto the sacrum. So that joint gets its stability by basically interlocking itself with the pelvis itself. So it interlocks itself with the pelvic bones, and you can kind of see how that occurs here. It's basically a couple of, when you take a look at the joint surfaces themselves, they look like an L that basically lock into one another and create some stability in that fashion. Now, in addition to that, the joint surfaces themselves basically are irregular in shape, and they basically lock into one another like this, so that the movement that occurs at that level here. And then finally, the joint itself is made up of some of the strongest ligaments in the body, both on the back side, which is a very complex set of ligaments, and to a lesser degree on the front side. This is a much weaker set of ligaments. Now, ligaments are the connective tissue that connects bone to bone. It's not to be confused with a tendon, which is the connection of muscle to bone. The ligaments basically connect bone to bone. And those ligaments have to be very, very dense, have to be very strong in this area to provide that extra support. Now, what happens in cases where there is dysfunction in the sacroiliac joint is that because of some type of faulty movement pattern or some type of force that's been introduced into the joint surfaces can change in their normal resting position. So one of the most common causes of a problem here is that you can be walking along and you've either step in a hole or you step off a curb that you didn't realize was there. And I'm sure many of you have done that at some point in your life, and you get this jarring effect. Well, what happens is that there's a force that's driven through the pelvis here into the sacroiliac joint, and it basically creates a shearing force, and the potential for a change in the resting position of that joint can take place. And as a result of that, you can have pain that develops as a result of that change in normal resting position. The longer that goes on, the more changes that take place outside of the joint. In other words, the muscles that support the joint or that are around this area will shorten, some will weaken, and that is what we refer to as a muscle imbalance. So the way to treat this properly is to actually, number one, identify the source of the problem. And you have to understand that this is a fairly complicated system here. So there's motion that occurs here in the pelvis, there's motion that occurs here at the sacrum, and there's motion that occurs here on this front joint here. And you have to be able to know how to identify that dysfunction, number one. Number two is that once you have the pieces in place, you then have to be able to sequence the treatment in a specific order in order for there to be a restoration of the balance, not only in the muscular system that support the pelvic girdle, but also balance within the joints themselves. So that is the way that you would go about assessing and treating a particular sacroiliac joint condition. I hope the information that I provided you today has been helpful in your understanding about sacroiliac joint dysfunction, and that you may in fact be able to use this information in your pursuit of back pain relief. If you would like additional information about how my program might be able to help you in solving your particular situation, just click the link you see right below this video, and I'll be happy to help you with whatever problem that you may be experiencing. This is Mountain Scheck wishing you all good health, and I do hope our paths cross soon.